Hi, I'm Mary, and the issue I will be talking about is prior authorizations with the innovative solution of automatic prior authorizations. So the problem is that insurance companies require these prior authorizations for a lot of medications, treatments, or testing, and they require this to make sure the medication, treatment, or testing is necessary so that they can control costs that they pay. It leads to a heavy administrative burden, which is the main problem, and it has negative impacts for patients. The administrative burden is that there's demanding paperwork, faxes, phone calls, survey questions, and a lot of waiting and monitoring the prior authorization. A lot of times the prior authorization form is sent in and then insurance companies are looking for something else and it goes back and forth, wasting a lot of time. Often they request alternative treatment or medications or testing before they approve anything, and then a new form has to be filled out to get the approval anyway. When it takes a lot of time, patients often abandon necessary care, which leads to increased cost with emergency room visits or them having to pay out of pocket. And the doctor is often unaware that prior authorization is necessary until the patient goes to the pharmacy and their medication isn't available to pick up, or until later on when they haven't scheduled testing yet or they can't get it scheduled because insurance hasn't approved it. Appealing the process if the prior authorization is denied is very lengthy and usually unsuccessful. This is just a graphic of what usually happens for patients. They're just kind of waiting and their care is postponed. The proposed solution is to integrate an electronic automatic prior authorization system software into the electronic health record. This would eliminate the third party and eliminate the need of a lot of phone calling and faxing. And the system would automatically populate clinical information fields for a prior authorization using artificial intelligence. This would happen in real time, as the system would be able to calculate what will need a prior authorization right when it's prescribed before a patient even leaves the room. This saves time and moves care along, and it prevents calls to the doctor's office and allows for time to be spent more productively rather than waiting and working on prior authorizations. Usually the pharmacy takes days to send a prior authorization request, so this would save a lot of time. For current work setting limitations, there are technology limitations. I work in a small practice, so this would require a software update, which would require a hardware update, which would have a lot of initial costs to this, as well as the cost for IT to program everything within the electronic medical record. Without the proper hardware, it's a setup for failure, and there could be a lot of issues with the system. And it's not feasible for a small practice to do this, but for larger practices that usually have hardware updates often, it would be more doable. Implications for clinical practice. The implications are that there's usually no additional costs besides the initial ones. Other real-time drug benefit tools are of no cost to the provider. There are savings due to reduction of staff time spent on prior authorizations, and it leads to better care for patients and increases satisfaction. The software leads to less entry errors, which causes higher authorization approval rate and quicker approval rate. And getting stuff approved quicker allows for providers to get reimbursement quicker, which increases productivity and is good for business and for the patients. So it's a win-win. In conclusion, informatics can alleviate the burden of a lot of issues like prior authorizations, and it's important to weigh the pros and cons when it comes to artificial intelligence as a solution. There's a lot of benefits, but there's also a lot of things to consider when implementing these, especially if it's a small practice. Electronic automatic prior authorizations would lead to better care and less money spent on prior authorizations, alternative treatment, and urgent care and emergency room visits. That's my references. Thank you.